Lotus Birth. There's many claims of benefits out there, but let's look at 5 claims of benefits and see if they are fact or fiction. So what is Lotus Birth? It means not cutting the umbilical cord after the baby is born. And so the placenta and cord remain attached to the newborn until the cord dries up and falls off. Proponents of this practice will take the placenta, place it in a bag or a bow, and then they'll put on the placenta different types of herbs and salts and essential oils, and then the cord will dry up and fall off after 3 to 10 days. So let's look at the evidence. First of all, proponents say that Lotus Birth is nonviolent. Is that fact or fiction? Actually, that is fiction. There are no nerve endings in the umbilical cord. So when the cord is cut, there is no pain for the baby to feel at all. Also, it's claimed that the placenta is nurturing to the newborn. Is that fact or fiction? That's actually also fiction. There is no further nutrition or oxygen getting to the baby after the circulation in the cord stops. And that happens, the cord quits pulsating after about 5 minutes after birth. So after that point, there is no way that any nutrition or oxygen or benefit can cross the cord into the baby. Hi, I'm Susan White, certified nurse midwife with Childbirth Education for the Christian Family, and I want you to be informed so you can feel empowered in birth. Please stay till the end, and I have a free resource to give you. And also, please click like and subscribe if you're finding this helpful. Also, it's claimed that Lotus Birth reduces anemia in the newborn because the baby gets more blood from the placenta. Is that fact or fiction? That is fiction. That's true. There is extra blood circulating through the cord and placenta that belongs to the baby. However, it is the standard of care now to do what's called delayed cord clamping. That means we wait to clamp and cut the cord at about 2 or 3 minutes after birth, sometimes waiting up to when it quits pulsating, maybe at 5 minutes. And so the delayed cord clamping has a lot of great benefits. We get that extra blood to the baby. So baby does have less anemia later on in life. They get that extra oxygen to let them adapt to life outside the uterus. But after that cord quits pulsating, there's no further benefit to leave the cord and placenta attached to the baby. Some claim that Lotus Birth helps bonding between mom and newborn. Is that fact or fiction? This is fiction. So how can we support the baby bonding with mom? Actually, the best way is to do skin-to-skin contact right after birth. So after your baby is born, your provider should place the baby up on your abdomen and chest area, and then that skin-to-skin contact is going to enable that baby to be able to do what's called the crawling reflex, where they can actually crawl up and self-attach and start nursing. So that skin-to-skin contact for that whole first hour and that first breastfeeding are really the best way to get your bonding going with your baby. What about the belief that Lotus Birth has no increased risk of infection? Is that fact or fiction? That's actually fiction. There are beginning to be more and more case reports in the scientific literature about problems with infection with the baby when Lotus Birth is practiced. There's been case reports of the cord getting infected, of the baby having different types of infections, including sepsis, that's a blood infection that can be life-threatening, and even babies getting hepatitis. So if you think about it, once that cord quits pulsating, that placental tissue starts decomposing. And with decomposing tissue, you have a high rate of bacteria being able to get in there and cause infection. So this is one of the most concerning risks that we see with Lotus Birth. Would you like to have a free copy of my resource should you have your labor induced, and also save a discount on my Childbirth Education classes? Just go to the link in the description. And next, I'd like you to check out my video on fetal monitoring and know your options. Thanks.